live right now. Good morning, PTNS Daily Show here on Clinical Tuesday. Happy Tuesday morning. I'm your host, Alan Sewell-Weiss, faculty member in our Fitness Athlete Division and Modern Management of the Older Adult Divisions. This morning we have Ryan. Some of you know Ryan from Grafted In. Ryan helps with our marketing here in the clinic at Health HQ for ICE and also for the gym. Some of you work with Ryan. Ryan happened to be lingering around the gym looking sweaty, so he will be my demo today. What are we talking about today? I want to show you some manual therapy techniques for the overhead athlete. So obviously here in CrossFit, doing a lot of overhead stuff, overhead squats, snatches, pull-ups, muscle-ups, handstands, all that sort of stuff. But also if you're working with Olympic weightlifters who are snatching, clean and jerking, and doing overhead squats. Also athletes like gymnasts doing a lot of stuff up on the bar, up on the rings, on the floor with handstands and being up on their hands. And also just recreational folks lifting weights, folks who may be doing shoulder press, strict press, who may be doing bench press in the gym, your power lifters, and also your throwers, your football quarterbacks, your baseball pitchers, anybody that's lifting their arm overhead against loaded resistance. I want to show a couple techniques here. Really focus on the inferior glide of the shoulder to help internal rotation, but also to promote getting actual true in-range flexion. Last night on Clinical Management Fitness Athlete, we were talking the importance of having true anatomical shoulder flexion, its importance in the overhead squat and the snatch, and how even folks who are missing a couple degrees of flexion, how that can translate into having that bar forward of them and just being unable to lift any appreciable amount of weight due to missing a little bit of in-range flexion. So I'm going to show you some techniques to help clean up that flexion and also help clean up that internal rotation. You can help folks who are having pain, especially in the CrossFit realm, the Olympic weightlifting and gymnastics realm, who may be having pain with muscle-ups, pain with handstand push-ups, pain with jerking and snatching. If you can help clear up their internal rotation and their in-range flexion. So the first one I'm going to show, you're probably all familiar with this one from school, just your standard inferior glide. I've got a little towel here built up under Ryan's shoulder. That's just putting him in a little bit of flexion, external rotation, and abduction. From here, going to stabilize right under the fossa, give a literal inferior glide, and also a little bit of a traction pull with the palm of my hand. You're all probably very familiar with that. That's really good for that acute patient, maybe somebody who's post-op, maybe somebody is really acutely flared up. That's a good place to start here. You can rock that. That's very, very gentle. But I want to show you a couple techniques that get a little bit more aggressive, especially to work into that in-range flexion and that in-range internal rotation. If they can tolerate that, the progression from that I like to take is just taking their arm overhead into flexion, stabilizing, grabbing on the top of the proximal humerus and giving that inferior glide down. Here too at the elbow, you can give that same pull and traction as you glide the humerus down. I like that a lot more. It's a lot more functional. We're getting a lot more and working a lot more into that in-range flexion you can see here versus being down with the arm at the side in neutral. I like this one a lot. You as the therapist, you can sit here and rock this all day. It doesn't really take a lot for me to rock this mobilization. From here to get into that internal rotation, we can take Ryan, set him up into a little bit of internal rotation, stabilize here at the proximal humerus, give that same glide. But now what I like about this one is we can make this mobilization a little bit more active. So I can ask Ryan to push his hand, the back of his hand into my shoulder, and then relax. And now I can move him into various degrees of internal rotation. As I mobilize, have him contract again. So lift your hand up, good, good, and relax. Even more internal rotation as I'm continuing to mobilize at the shoulder, lift up again, lift, relax. And so now we can add in that contract, relax with that inferior glide at the same time and really, really clear up that, relax for me, clear up that internal rotation, move them into varying degrees of internal rotation, and try and get them to full internal rotation as you mobilize the shoulder. So a couple quick techniques there. What does the home program look like for this? We're going to have Ryan switch and get on hands and knees. That's up on the table, yeah. Foam roller, ideally one of the long foam rollers. He's going to put his hands on that foam roller. What this looks like at home is at home, heavier band than this, a really thick band, a band that we might use for lumbar traction, maybe a bike tube, attached to something, attached to the table leg at home or on the doorknob, giving that glide, and then all he's going to do is kind of scoot down on the table more. He's going to rock kind of that prayer stretch. He's going to use the foam roller and move his arm up, so roll it up. He's going to roll into whatever degree of flexion is tolerable as this band gives that inferior glide at the proximal humerus, and then roll it back up. So really thick band is going to give a really nice inferior glide as he rolls out into flexion and back up into neutral as far as he can tolerate, as far as the symptoms allow. Again, working into that in-range flexion. Go ahead and come out of there. So that's the home program for that glide. Next week, we're going to talk about the assessment. Actually assessing in-range flexion, assessing in-range internal rotation, especially in prone. We don't often assess that in prone enough. We talk about that a lot in the fitness athlete division, making sure we're checking prone. Do they actually have full active range of motion into things like flexion, into extension? Those lack of range of motions can often contribute to pain, especially with that overhead athlete. If you think about the transition into something like a bar muscle up or the high pull and snatch, if you don't have that in-range internal rotation, often will translate at the humerus and irritate the labrum, the bicep tendon, the pec tendon as well in a bench press if we don't have that in-range internal rotation and extension. So we'll show you how to assess for those, and then a whole bunch of mobility exercises, home exercises for those motions next week on Tuesday. So sorry if you're on the podcast, make sure you jump onto YouTube or Facebook or Instagram and catch the video of these. And then next week, same thing, tune in, we'll go over the assessment and a couple of home programs for these different motions to help clean up in-range extension, flexion, internal rotation for the overhead athlete. That's all we got. Hope you have a great Tuesday. We'll see you all next time. Have a great day.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.